patients simply don't know the cost of care or treatment before they're getting it. They're getting sicker as a result of not paying for it. We've hit a tipping point and patients are going to explore alternative options because the status quo is not working.
Hey gang, it's Thursday, January 18th. Lisa, Rajiv, and listeners, welcome to the Behind the Numbers Daily and eMarketer podcast. I'm Marcus. Today I'm joined by two folks who both are on our digital health team. We start with our principal analyst, Lisa Phillips, based in Connecticut.
Hi, Marcus. Nice to be here.
Hello. And we're also joined by Rajiv Leventhal, who is one of our senior analysts based in New Jersey.
Hey, Marcus. Thanks for having me.
Hey, chap. So today's fact. Okay, I'm hoping that this term translates into American. Otherwise, this is going to be just for our UK listeners. Do you know the term to ring true? If something is to ring true?
Sure.
Mm-hmm. I've heard of it.
Okay, cool. All right, good. So where did that term come from is today's fact. So to ring true, so it means to appear authentic, to seem likely. And the allusion here is to the former method of testing coins by dropping them on a hard, cold surface. Those of pure silver or gold had a distinctive ring, i.e. they rang true, while those of base metal had a duller sound. This is a way of testing if money was real. Today, a bit more complex. We've got national mints that have adopted a multiple anti-counterfeiting technologies to protect paper money. So it's a bit more advanced. There's like serial numbers and color-changing ink and microprinting and security threads, 3D ribbons, watermarks, all kinds of stuff. But back in the day, you just dropped the coin on the floor and listened.
Probably happened in colonial America too. So
Yeah. But next time I get change at a grocery store, I'm just going to drop it on the floor and be like, 1 second. It's legit. Okay, fair enough. Anyway, today's real topic, the great behind the numbers takeoff, health trends 2024. In today's episode, first in the lead, we'll cover health trends for 2024. No other news today. This is the Great Behind the Numbers Takeoff, Bake-Off style episode, Health Trends 2024. In today's episode, our takers or bakers will be cooking up some health-specific expectations for the coming new year. 3 rounds, signature take, the how it will technically play out challenge, and the show-stopping argument. Let's meet the contestants' predictions. Lisa, what is yours?
healthcare is going to be a hyper-partisan issue in the 2024 U.S. election campaigns, and that will affect how people think about and deal with their own healthcare going forward.
Perfect. It's going to be a rosy episode. And Rajiv, how about for you?
Not much rosier, unfortunately. 2024 will create unprecedented challenges for patients when it comes to affording their care and treatment. As they rack up medical debt and become sicker, they'll look to other options for accessing and paying for their healthcare.
Good God. All right. It's pretty bleak. If you want to stop listening, folks, I don't blame you. But we're going to press on in case you do want to hear the rest of the show. Some fascinating predictions. Very interesting to hear how these are going to unfold. We start with round 1, which of course is signature take. Our chefs will have 1 minute to explain the premise of their trend. So we go back to Lisa talking about how healthcare is going to be a hyper-partisan issue in the 2024 US election campaigns. Tell us a bit more about this, Lisa.
Well, Donald Trump has said that he'll try to repeal the Affordable Care Act, which was passed in 2010. And if he's reelected, we expect to hear a lot more about that. On the other side, KFF, formerly known as Kaiser Family Foundation, published a poll from November 2023 that said voters want presidential candidates to talk a lot about healthcare-related topics, even though 99% said, inflation is their biggest worry. 99% also said the cost of healthcare was very or somewhat important for presidential candidates to talk about. You're welcome, Rajiv, for teeing you up on that. But they're also, like 97% said they're concerned about the future of Medicare and Medicaid. And about the same said are upset about the cost of prescription drugs. And they want to hear candidates talk about mental health, the opioid crisis, the future of the Affordable Care Act and abortion. So it isn't just the politicians that'll be looking at this. It's voters who are looking to the politicians to talk about it.
Yeah. Healthcare seems to be at the top of the list. A Gallup's poll, when they're asking what are the main issues for voters, for Americans, it's typically economy, then jobs, and then healthcare is typically quite high up at some other ones that will fluctuate based on what's going on in the news, whether that is taxes or whether that's inflation, COVID. But healthcare does live at the top of those charts. So it's perfectly understandable. Rajiv, how about for you? You're talking about this year creating challenges for patients when it comes to affording healthcare and treatment and what they're going to do as a result.
Yeah, so the writing is really on the wall for anyone who's paying attention. I've got some pretty interesting and alarming data points for you, Marcus. We know that more than 1 in 3 adults, so over a third, even those with insurance, deferred care or treatment in the past year because they couldn't pay for it. So over a third skipped out on medical visits or medications because they couldn't pay for it. And that's according to a July 2023 Commonwealth Fund healthcare survey. Another issue is that patients simply, in many cases, again, with insurance, don't know the cost of care or treatment before they're getting it. They're hit with surprise bills, often after the fact. They don't know the price of their medication until they're at the counter, picking it up. And sometimes they might just skip out and not complete that transaction. And almost half of adults in another survey said that they've skipped out on getting care or treatment because they didn't have that upfront price information. And these patients can't just put off care forever, right? They're getting sicker as a result of not paying for it. And in that Commonwealth Fund survey, half of people who admitted that they put off care due to financial reasons got sicker because they did skip out on that care or treatment. So we've hit a tipping point, and patients, we're going to get into this in the next round, but patients are going to explore alternative options because the status quo is not working.
Yeah, there's some quite shocking numbers, especially when you're starting to get close to what you would refer to as most people. Let's move to round 2 and get a bit more detail on some of these. This is, of course, the how it will technically play out challenge. Our chefs will explain in more detail how they expect the trend to unfold throughout the year. Lisa, we bounce back to you talking about healthcare being hyper-partisan in 2024. How do you see this manifesting throughout the next 12 months?
Everybody's losing trust in healthcare institutions. I'll say I have some numbers. So the pandemic created a lot of mistrust and misinformation around COVID, the vaccines, and various treatments. And now there's a big divide between Democrats, Republicans, and independents over who they trust most. And my doctor is almost universally trusted by 95% of both Republicans and Democrats said my doctor is who I trust the most. Only 86% of independents said the same thing. But when it comes to the CDC, the Centers for Disease Control and Prevention, 87% of Democrats trust that institution, but only 56% of independents and just 49% of Republicans say they trust the CDC. When it comes to the Food and Drug Administration, which approves prescription drugs and medical devices, 79% of Democrats trusted the FDA, 55% of independents and 54%, almost just about half of Republicans said the same. And when it comes to their local and state public health officials, just 74% of Democrats said they trusted it. 58% of Republicans and 50% of independents. Included in that was who would trust the Biden administration, and Democrats would far more than Republicans, as well as vice versa for a Trump administration. People are really falling out and not getting vaccines, not getting care, as we know, or even health flu shots now. It's
depending on who's telling them to do it, right?
Yeah, exactly.
It does seem as though people will choose to believe the information based on the institution. Like you said, CDC Democrats will trust it, Republicans and independents less so. Same for the FDA. Biden administration, I mean, is staggeringly in favor of Democrats versus Republicans. Trump administration, former President Trump, the complete opposite. And so that is quite shocking. You mentioned their doctor. That was about 90% or give
95.
or take. Across the board, though, for independents just below, Republicans and Democrats just above.
Same,
95, yeah. pretty high. Yeah, exactly. Same for Democrats and Republicans, which is surprising. They agree on something. But in terms of that's trusting their doctor, but you do have some research in this health trends report for 2024, showing that if you do some research, you basically become a doctor. Because you say among young people, at least 18 to 34, nearly half, so the average person who has done their own research is just as knowledgeable as a doctor. Yes. On most health matters, according to Edelman. So they may trust their doctor, but at the same time, they don't trust them, it seems, as much as they might trust themselves after doing a little bit of homework online.
Yes.
Yeah.
That's true. It's scary. It's true.
Yeah. And then taking the totality of the health industry, another stat, people just don't trust healthcare in America. The healthcare industry, only 35% approval rating according to Gallup, and it's on a downward slide as well.
Has been for some years.
Not good news. Okay, wow. Rajiv, let's move to you. Talk to us a bit about how your trends of Americans turning away from the healthcare industry to alternatives is going to play out.
Yeah, if you operate under the premise that many patients are frankly frightened about what their medical bill is going to be, or what the price of their prescription drug will be, because many don't understand how deductibles work, et cetera. They're going to start exploring other options. And this, you mentioned, social media. This might range from, well, okay, maybe I can't access a doctor because of affordability issues, but there's a healthcare influencer on TikTok who's talking about the symptoms I have. I'm going to click that video and at least, maybe put off the need of going to the doctor or taking a medication. There are other condition-specific online groups or communities, self-diagnosis, that scary stat that you just noted. This might not end well, right? You're eschewing the system because you can't pay for it, and you're looking at these other options that might be free or low cost, but you have no idea if this is credible information, if this is knowledge that will help your condition or your symptoms. So it's pretty scary stuff. And then from a pure cost perspective, I believe we will see a lot of consumers searching for healthcare providers that offer subscription or bundled-based medical services, so they don't get slammed with a huge surprise bill after a visit. They might look for cash pay services that aren't available, necessarily in their insurance network. And while yes, that might cost more than going through your insurance, at least from an upfront standpoint, they'll have that price knowledge upfront, and you won't get a bill for $1,000 4 weeks after service, or you won't see your medication costing $200 because you haven't hit your deductible when you thought it would be 1/5 of that. So those types of upfront pricing services that we see in other industries could very well expand to healthcare. You're already seeing that happen somewhat. And then lastly, I think we'll also see more patients use discount or coupon cards to save money on their medications. We're seeing a bunch of pharma manufacturers and other pharmacy startups and pharmacy players try to roll those out so that consumers will actually pick up their medications at the pharmacy, because if they don't, of course, that hurts pharma companies' bottom line. So I think those are some of the developments that we'll see unfold this year as a result of just the conventional system being tough to afford for so many patients.
So help us quickly to understand this idea of the more people exploring subscription-based healthcare bundles. What might be some examples of those, and why is it that the list prices are so much more transparent than more of a traditional insurance plan?
Well, it's for non-emergent primary care type issues, but we're seeing retailers like GNC and Costco and even CVS and Walgreens don't have subscription-based primary care services, but they do show you the cost of a service online, as you're looking to schedule a visit. So while, people might not want to pay for that on top of, their whatever their insurance premium is, they might just be sick of the lack of access and the high cost of, potentially what their insurance covers or doesn't cover. We know that insurance denials are increasing significantly. A patient goes to a doctor and they get a service, and they find out a few weeks later that, well, your insurance actually didn't cover this. So who's on the hook for that? Well, now the provider has to work that out with the patient. And these are really friction points that are frustrating the consumer and
physicians too.
And physicians, yeah. And that's why these other options are emerging. So maybe you can get unlimited access, telehealth access through one of these subscription programs, and you pay a certain amount each month, and you get to text or video chat your doctor really whenever you want. So those are the type of things that we're seeing.
Okay.
Well, I'd say that, Rajiv, you and I are coming at the same thing with
it's pretty intertwined. Yeah. There's a lot of overlap. And that's why our trends theme was patient fragmentation. Like the patient care journey is going to become fragmented because of these kind of sub trends that are funneling into the overall theme
affecting behavior.
Yeah.
And to your point, and you said you get a surprise bill 4 weeks after. I'd say 4 months, 4 years. I actually got some kind of, I forget if it was some kind of a bill from Greenwich Hospital 18 years after I had a procedure there.
Oh my God.
We'd moved out of the house, and the person who we sold it to still lived there, and he contacted us and said,
my God.
This came and it looks kind of official, so I just wanted to let you know.
Yeah.
I mean,
and every entity kind of has their own process for tracking down people who have outstanding medical debt. They might put a debt collector on it if it's a really large amount. We saw a health system last year cut off patients who racked up a certain amount of medical debt. Let's say the bills are just too high and the patient simply couldn't pay it. They tried to log back into the system to schedule a future appointment, and they were blocked. So that you can only imagine the type of disruptions in care that outstanding medical debt and provider and insurer actions, what kind of disruptions those can cause.
Yeah. All right, folks, let's move to round 3. That is, of course, our show-stopping argument. Our chefs will pull out their best closing arguments as to why their trend is most likely to happen. In 20 seconds, Lisa, tell us about why you think your trend is more likely to happen than Rajiv's, even though they're kind of the same.
We're kind of the same, yeah. The more Americans hear about the healthcare system in the election campaign of 2024, I think the more their trust will erode, at least for a lot of people. I think some may be getting care altogether. Will stop getting care, as Rajiv was saying, and they'll suffer the consequences. A lot of them are turning to social media and social media influencers to check symptoms and treatments, and they could suffer the consequences of doing that. Nothing is going to change fundamentally in the U.S. healthcare system in 2024, is my prediction, but watch out in 2025, depending on who is elected.
It was a shocking stat you had. It's just a sea of misinformation online with regards to health information, and people just not knowing up from down. 8 in 10 Americans believe there's a prevalence of false or misleading health information on social media, but nearly as many, 7 in 10, admit they're unable to assess true from false or misleading information.
Right.
According to a health affairs scholar.
And that's really the key. Like, they know that a lot of this crap information is out there. They just don't know how to discern the reliable information from the disinformation and the misinformation. And that's really scary, because if you can't tell what's right and what's wrong, well, how is that going to affect what you act on?
Yeah. Rajiv, your show-stopping argument.
Well, because every aspect of U.S. healthcare is just getting more expensive, from regular visits to the primary care physician to hospital stays that are more complex, and to paying for medications. So that's all going to lead to more out-of-pocket spending for consumers, reflected through higher insurance premiums, more denials, which puts patients on the hook for an increased amount of what they owe, and then more spending on drugs. We're seeing, the craze of GLP-1 weight loss drugs. Well, none of these are going to get cheaper, and with every part of the U.S. health system getting more expensive, is just going to lead to a world where patients cannot afford their regular care and their treatment, and they look at alternative options.
Yeah, very nice, folks. All right, that's it for the episode. Time to crown a star taker or baker. And today it has to be both of you, because you started off in separate kitchens and eventually ended up in the same one making the same meal. A lot of overlap.
We're a team,
some really,
that's for
really
sure.
interesting trend. Absolutely. Those are fantastic takes. So congratulations to both of you. You are both our star taker or bakers today. That's all we've got time for this episode. Thank you so much to you both. Thank you, Lisa.
Oh, thank you, Marcus. It's been wonderful.
Absolutely. Thank you so much to Rajiv.
Hey, thanks, Marcus.
Yes, indeed. Thank you to Victoria, who edits the show, James, who copy edits it, Stuart, who runs the team, and Sophie, who does all of our social media stuff. Thank you to everyone for listening in. Tune in tomorrow for the Behind the Numbers Weekly Listen, an eMarketer podcast.